I hope you're all doing well. Welcome back to the iFitNurse Pearl series. This is video number 9, discussing what to do during shift change. Okay, so I have found certain tasks that you should do, obviously, when you're giving the patient over to the oncoming nurse, as well as certain tasks that may help you get your day started off. So first thing is first, obviously get a good bedside report. Go in there, see the patient, make sure that everything is matching up, and jotting down their initial vital signs, what medications are they on, making sure that everything adds up, that all the dosages and all of that is on your flow sheet, introducing yourself and making sure that the patient is safe, okay, that you're going to take a report and you're going to care for them for the shift, and you're not just going off of what the previous nurse is saying, and then you go in and it's totally, they don't have an IV, they took out their Foley, they're no longer on this drip, or they needed to be on a drip, or it was, so go into your room, assess the patient, write down the initial vital signs. Like, let's say if they're a patient going in and out of different arrhythmias, see what arrhythmia or what rhythm they're in. Let's say if it's a neurological patient, or assess, do a Neuro Check together. Okay, that is like the number one thing. Do a Neuro Check together, especially if you have to do them every 1 hour, every 2 hours. Doesn't matter how frequent. You want to make sure that the nurse that you're receiving a report from saw the same thing that you're seeing. Okay, so sometimes I don't want to say it's subjective, but it could be. Okay, so some people, let's say, I always overestimate the pupil size. I'm like, we have a reference point right here, so I get it, but it's easy to say, oh, that's a 5 versus a 4. Okay, so what I like to do is when I'm doing my assessment, I'm doing a quick assessment, obviously, on overall, but let's say when we're doing our Neuro Check before let's say the night nurse leaves, I go ahead and do my Neuro Check, and like, okay, is that the same pupil size you've been saying? What have you been calling that? Okay, so it gives me a good reference point. So that's the first thing. Obviously, doing a good Neuro Check, making sure the patient is as the previous nurse has been explaining to you, okay, that you find out what drips and what dosages, everything that has been recently changed, so you know where you're starting off of. Okay, for instance, let's say restraints. You want to make sure that, let's say, if they're supposed to have restraints on, they still need restraints. Do they still need it? If not, go ahead and DC them. Okay, or at least make sure that it's appropriately on them. Okay, make sure they're tied well, that there's nothing that could cause them harm. Okay, and then big thing is turn your patient, okay? This is your opportunity with that night nurse to not only assess your patient posterior, so you can do your auscultation there, so you can obviously listen to your lungs on anterior and posterior. You can turn, listen, you can assess their backside, okay? You can take off that Mapilex and assess, let's say they have any wounds, to see where the wound healing stage is at, or if they don't have one, or you may even catch the beginning of one, okay? So that's why you want to turn. And biggest point too is to make sure that they're clean. I can't tell you how many times, and this is, it happens to all of us. I'm like, hey, I just turned him like an hour ago. He should be clean, You turn him and it's like everywhere. So that gives you an opportunity to have that nurse's hands, because everyone else is in shift change, okay? So that gives you, that nurse can help you clean them up and get them comfortable again, and then you can start your day. Even also looking, let's say, it depends on what's going on with the patient, but if they have lots of wounds or whatever, you can review those wounds and like, okay, is that what you were looking at? So yeah, that's pretty much it. So look at your patient, turn your patient, make sure your patient is clean. Listen to them. If there's anything, like even they're there for a GI bleed, like if they had a bowel movement, you want to, okay, is this the color? Is this the amount? Is it getting better? Is it getting worse? Assessing any drainage. So for instance, if they have an NG tube that's like to intermittent suction, is that all of mine? Making sure that you have your measurements. What amount is what I would have to consider for my intake or output, as well as for like the chest tube. Okay, make sure everything's labeled and then, okay, is it getting better or worse? Or a Foley catheter, is there blood present? Are you seeing it getting bright red? If it is red, okay, is this what you've been seeing during your shift? Is this something I need to call the physician about? Are they aware of this? Or let's say, are things improving now? It's like a light pink. It's like, oh yeah, it was really bad yesterday, improving today. So these are things that you're going to need to do a good assessment. And then sometimes you may have physicians walk right in and ask all these questions. You want to be able to provide them, because they probably won't have an opportunity to talk to that night nurse. They're talking to the day nurse, but you want to give them, oh yes, it appears that the chest tube drainage is decreasing. Yesterday was 100, now I'm at 50. It was bright red, now it's light pink, and you go from there. Other things that I like to do during shift change is ask the night nurse if there are any questions that the patient or family members have. That's probably the biggest area of where things could fall off. Let's say if family was there the night before, they had certain questions, and then it never gets communicated to the day shift nurse, and then that's who we end up seeing. And we, if it's a process of, let's say, they're requesting some medical records to help fill in the gaps, hospitalization, and I never got that message. Sometimes it takes a while to get obviously all the medical releases put in, faxed, request those reports back, and then communicated to the physician. So you could lose a whole day like that. So I like to get in the habit of, when I go in, obviously introduce myself, explain that I'll be taking over, and if there are any questions that family or patient has left, or even talk to them directly, and then go from there, because that's what I will add to my list as I take care of them throughout the day. So we already talked about making sure that we are on the same page in terms of the medications, the drips, the amounts. You want to go ahead and do a good, thorough chart check. Yes, review all of the orders. Make sure, I like to do from the most recent to the oldest, and I go down. Okay, was that done? Was that done? What is this about? Did they receive blood? Oh yeah, I forgot to tell you, they received 2 units of blood yesterday. So it helps to fill in the gaps. So when they leave, I'm like, if I didn't do that and they left already, and I'm going down the list, and it seemed like during the report there's really nothing else going on, the patient's stable, and I run across and I see an order for PRBCs, I'm like, hold on, did this person ever get blood? Why? You see what I'm saying? So it helps to create a more full picture from the nurse before, because sometimes a lot of things just, slip our mind. So it's a good way to make sure that you are aware of the orders, where they stand, what you need to add to your plate so you can get done. Lastly is documenting any controlled substances or anything that's in the PCA, like propofol, fentanyl, Versed, anything like that. You want to document and agree. Normally when it's programmed on the pump, you will see the volume to be infused. And some nurses program it differently, where they say, hey, instead of the propofol 100, I always do 80. So if during the report I see 80, then only like 20 have administered. Does that make sense? Just agree. The whole point is to agree on the amount that is left, obviously compared to what's programmed, so you can document it. You don't want to see any discrepancies arise from how much was in the initial medication volume to be infused to how much has infused and then how much is left, okay? So that will get you in quite a bit of trouble. What else? I like to just make my patient comfortable, make sure that I update my whiteboard, that everyone knows, like if they need anything, to have the call bell available. I love to make sure, you have to, especially in the ICU, make sure your bed alarm is on, and make sure your bed is at the lowest position. Make sure the patient is safe, especially if you're dealing with ventilators or any trachs like that. You want to make sure that the patient's not like reaching for it, and that they're not going to put themselves in a position where they can jeopardize the artificial airway. Lastly, I like to make sure my room is kind of clean. Again, I can come back, but just initial presentation of starting my day, I like to just start fresh and start clean, and just, again, that will all change, especially if you work in a critical care setting. Not every day can be like that, just saying. But I hope you got something out of it. Doing a good bedside report during shift change will help you. So for instance, if you saw an order, well, let's go backwards. So not only do you get to meet the patient, you get to see how they are. Do they look comfortable in bed? You get to help reposition them. You can assess and auscultate their lungs. You can assess their wounds. You can turn them. You can clean them. And you can obviously update the family that you're taking over. So all of that you can do during your shift change. If you're going through orders and you catch, oh, I see you didn't send lab work, is there a reason? Oh no, I can do that before I go. I'm sorry, it was an oversight, I didn't see it. So you can do that. So imagine if you didn't do a thorough bedside report. So when you go meet your other patient, then you sit down and you're looking at your orders, you're like, oh, okay, so they didn't renew the restraints. Crap, now I need to figure out how to fix that. Or, you know, like you have to talk to your charge nurse and go from there. Or I see that they ordered blood. Did they give it? You have no one to ask anymore. So do I need to give blood? Is there lab work? Oh, I didn't see the lab work. They said they sent labs, but now it doesn't even show pending. So did they send labs or not? No. Or you see what I'm saying? Patient, then you go in to do your assessment and the patient's dirty. You're like, we were just in here like 10 minutes ago. And it could happen, but you will learn. I'm like, okay, they were dirty for a while. So when the patient is sitting and they're like soiled, and you don't want that, okay? So yeah, doing a good bedside report definitely starts you off much better. It'll save you time, and I've learned that the hard way, and so I'm hoping that these tips really help you start your day off. So if you have any questions, leave it in the comment section below. Don't forget to comment, like, and subscribe, and share the videos. Bye.